Good morning, good afternoon, good evening, depending the time you are streaming this video. Of course, I'm Oswena. We are here today to talk about intestinal obstruction. So, in the studio, I have my colleagues now by the name of Suleiman Kruman. So, to begin with, what is intestinal obstruction? So, intestinal obstruction simply means when there is a partial or complete blockage of intestine. It can be the small intestine, it can be the large intestine, in which food, water, or gas cannot able to pass through. That is the meaning of intestinal obstruction. Which means you dey eat food, but you no go pass that food there. You can eat, but you no go fat for pass gas. Na im we mean as intestinal obstruction. So now to the cause. So one of the cause of intestinal obstruction is adhesion. That is when there is a scar tissue on the wall of intestine. It can be the small intestine or the large intestine due to a previous surgery and a neuropathy or tears. The other cause might be taking in of foreign bodies like coin. Taking in coin can block the peristaltic movement of the intestine, right? So the next is intussusception. Intussusception is the telescoping of intestine of itself, making it very difficult for peristaltic movement of food. Then also tumor. Tumor also can shift or press on the intestine, making it very difficult for movement of food within the intestine. And also diverticulitis. So diverticulitis also can lead to intestinal obstruction. So the next one, which is also very common, fecal impaction. And the other one is volvulus. Volvulus is the twisting of intestine, making it difficult for food contents, gas, or water to pass through the intestine. So now to the signs and symptoms. So what are the signs and symptoms that individual might experience during this condition? One is abdominal tenderness, and you will notice that your abdomen got swollen bit by bit. So, but I'm not telling you that when you see your abdomen going up that you have intestinal obstruction. You need to visit the hospital. You need to visit your doctors. Let them tell you that, oh, you are suffering from intestinal obstruction. So the other symptoms might be abdominal pain. You may experience abdominal pain, wherein the pain usually comes and go. It usually comes and go. Another symptom is inability to pass gas. So where we all know it is a normal thing to pass gas than like way the fat. We always say if the fat is good, which means the intestine is too clear, right? So also you may experience nausea and vomiting. Nausea and vomiting is not normal. And also, like I said earlier, you cannot be vomiting and you said you are suffering from intestinal obstruction. No. You need to visit the hospital to let them diagnose you that you are suffering from intestinal obstruction. But you alone cannot say you have intestinal obstruction. So for the meantime, I may like to invite Suleiman Kuruman to advise you guys about the preventive measures of intestinal obstruction.
Good evening to everybody watching this video. I'm Nurse Sulaiman Kurma, stationed at UBC Hospital Freedom, Bond Street. I'm here this evening to talk about the types of intestinal obstruction, as you rightly heard from my colleague, Brahma John. We have the first one, which is small bowel obstruction. Small bowel obstruction is more common than the large bowel obstruction. And of course, the leading causes are adhesion, hernia, Crohn's disease, etc. Of course, we also have the other type, which is the large bowel obstruction. Large bowel obstruction is not common as compared to the small bowel obstruction, and it is more dangerous as compared to the small bowel obstruction. And the leading causes of the large bowel obstructions are diverticulitis, volvulus, fecal impaction, and of course, um, the colon cancer. These are all the leading causes of the large bowel obstructions. We have another type which is the strangulated and simple. Strangulated and simple obstruction. For simple, it means there is blockage, which is also known as occlusion. Mm? When that occlusion occurs, blood blood flow is compromised, is still compromised. But for strangulated, when that occlusion occurs, blood flow, there is total blood flow and occlusion. So it means blood flow cannot go through, blood cannot flow through. So that is strangulated. For simple, as we say, when there is occlusion, blood flow is compromised, and for strangulated, when there is occlusion, blood flow is not compromised. We have another type which is complete and partial. For complete occlusion and obstruction, intestinal obstruction, it means there is total occlusion in the intestine, which does not allow the content of the intestine to flow through. And for the partial, there might be a little passage, not total occlusion, but little passage where the content of the intestine might flow through. I'm here this evening to discuss on the preventive measure and medical advice on intestinal obstruction. One, we have to seek medical advice when you have abdominal pain, when you are unable to pass stool, and you are experiencing vomiting. You need to seek medical advice from the hospital. Number two, post-surgical patients are at risk of developing intestinal obstruction because of adhesion for some years after they have undergone surgery. Number three, you have to stay hydrated and maintain high fiber diet. And you have to exercise regularly. Exercising regularly can also prevent you from having intestinal obstruction. And of course, we have to avoid lifting heavy load. Lifting heavy load can also lead to hernia, which is also one of the leading causes of intestinal obstruction. And when you are experiencing abdominal pain, you're unable to pass stool, you're unable to pass gas, and you are vomiting, you have to go to the doctor, do follow-up check, meet the doctor to see for the doctor to diagnose you whether you're having intestinal obstruction or you are developing any other medical condition. Thank you.